Daily Detroit is brought to you by the community. Support our work at patreon.com/dailydetroit.
On your Daily Detroit, what if the coronavirus spreads as it has in Southeast Michigan, but statewide? A recent piece by the nonpartisan Citizens Research Council of Michigan highlights how unprepared and dangerous that could be for outstate Michiganders, as many of the same problems that Detroit is facing, rural Michigan has, but with even less healthcare support. Tim Mischling joins me. I'm Jarrah Stays, and we're recording on Earth Day, Wednesday, April 22nd, 2020. But first, let's get into some of the things that you should know around Michigan and Detroit. Our top-line statewide number of confirmed coronavirus cases sits at 33,966. That's up 999 cases since yesterday. There were an additional 113 fatalities in the last 24 hours, bringing the death toll to 2,813. The city of Detroit now has more than 8,000 confirmed cases and 747 fatalities. We'll get into some news about the city in a moment. Oakland County is approaching 6,500 cases and 529 deaths. Macomb, more than 4,600 cases and 473 deaths. And the rest of Wayne County that's not Detroit, more than 6,500 cases and 572 fatalities. In a press briefing, Governor Whitmer said that more details on the plan to reopen the economy in phases may be coming within the next few days. Her key concern is a second wave, but the data in her view is looking cautiously optimistic, and currently, hospitals are discharging more patients than they are admitting. What probably won't happen is what's been done down in Georgia. Governor Brian Kemp there is allowing bowling alleys, fitness centers, hair and nail salons, and massage spas to open on Friday, and movie theaters and dine-in restaurants this Monday. In an interview with MSNBC's Chris Hayes on Tuesday night, Whitmer said that those would be among some of the last things to come back here in Michigan. Wayne County is investigating the circumstances behind approximately 50 bodies that were discovered at a makeshift morgue in Beaumont's Wayne Hospital. Following up on tips, health inspectors discovered the deceased on Tuesday after initially being denied access. Beaumont, for their part, says that they got approval from the City of Wayne's Department of Community Development and Planning to convert a section of the warehouse into a temporary morgue, most of which is being used for essential supplies. The hospital system in a statement said that they're storing the bodies in a, quote, safe, respectful, and appropriate way, unquote. In another sign of the impending budget cuts to come, the state of Michigan has notified state employees that temporary 10-day layoffs are coming because state tax revenue has severely dropped. As of this recording, we know of 200 workers impacted at the Department of Health and Human Services and 100 workers at the Attorney General's office. Unknown as of this recording, cuts to the Michigan Department of Transportation as well as the Department of Education. But that's not all. In previous episodes, we've talked about the city of Detroit's nearly $350 million budget hole. But today is news that Wayne County is expecting a budget gap exceeding $150 million, or at least a loss of 20% of their projected revenue. Details are still to come on how they'll address the shortfall. COVID-19 testing is continuing to expand. A drive-through facility has been opened in the parking lot of the Henry Ford Centennial Library in Dearborn. That's at 16301 Michigan. The site is in partnership with CVS, and there is no cost to eligible Michiganders for a test. You also do not need a doctor's referral, but you do need to go to cvs.com/minuteclinic/COVID-19-testing. Don't worry, we will put a link to that URL in the show notes to pre-screen. The governor's office says that the site will be able to test between 500 and 750 people daily. Speaking of drive-through testing, I wanted to take a moment and clarify the testing requirements at the state fairgrounds in Detroit. It was recently expanded to include city employees and essential workers without symptoms. But one thing that's important to note is that essential workers need to make sure their employer has registered with the city first. A worker cannot just call and schedule an appointment without that key step. Once the employer registers, and they can call the same number as everyone else at 313-230-0505, their request is reviewed by the city, and the employer will be provided a special code. Then workers can call with their employer's code and schedule an appointment. So far, about 200 employers have been approved to participate. A quick note in the private sector, well-known Michigan brand Founders is laying off more than 160 employees as uncertainty around COVID-19 and the reopening continues. WDIV TV4 reports that their retail employees at their tap rooms in Detroit and Grand Rapids, as well as their company store. Joining me via Squadcast is Tim Mischling. He is a research associate for healthcare policy with the Citizens Research Council of Michigan. Welcome to Daily Detroit, sir.
Hello, thanks for having me.
Absolutely. So I wanted to talk to you for a bit because you have an interesting article piece that you've written on crcmich.org talking about how all of Michigan is still at risk from COVID-19. First off, kind of what inspired you to do this, and what about your work at the Citizens Research Council kind of inspired you to put this piece together?
Sure. So just a little bit about the organization. The Citizens Research Council of Michigan was founded in 1916, originally as the Detroit Bureau of Research, and over time grew to have more of a statewide focus. So we're a statewide, independent, nonpartisan research organization that focuses on state and local public policy.
Okay.
So, as part of our mission in working to give citizens information so that they can make better informed choices and understand their government, we always say the right to criticize government is also an obligation to know what you're talking about. So, it's our obligation to try to put those facts out there and help people understand what's going on. Obviously, the situation with COVID-19 is consuming the news cycle and affecting everyone's life throughout the state. So we've actually put out a series of several pieces on COVID-19, the first of which was a few weeks ago before the stay-at-home order came out, and I wrote about the importance of things like paid sick time in supporting people in the event of a pandemic. And now we see that we're there and we're taking steps to try to bail out different industries, extend unemployment benefits, but all of this has been clunky. People have been having a lot of trouble and a lot of people are hurting. And so the most recent piece looks at the idea that COVID-19 is sort of a Southeast Michigan or a Detroit problem, and that it's not really affecting the other parts of the state, West Michigan and Northern Michigan. And I think there are some dangers to making that assumption.
Well, let's talk about those dangers. I think one of the things a lot of folks don't realize is that there is a lot of income inequality, healthcare issues throughout the state of Michigan, yet there is a kind of popular belief that COVID-19 is a Detroit problem, but it's not quite a paper, but your piece talks about how some of those issues are shared from Southeast Michigan, Detroit, and rural Michigan. Can you talk about that a little bit?
Yeah, in terms of health risk, I think, and in terms of a lot of things, we have more in common than not when we look at rural areas and inner city populations. And so Detroit obviously has been hit really hard by COVID-19. And one of the reasons for that is these huge structural inequalities that exist in the city that are not only healthcare access, but the things over time that affect people's health status, like access to healthy food, safe housing, the stress and trauma that people experience, this erodes their health over time, and you have higher rates of heart disease, diabetes, and those things in Detroit, along with a long history of racial inequalities, have really created an outsized impact for the city. Looking at the other side of that, when you look at rural Michigan, we have a really old population. It tends to be a poorer population, less educated population. There are higher rates of smoking, higher rates of chronic disease, high rates of disability. And all of these things speak to high risk of having adverse outcomes. And couple that with the fact that rural Michigan has really limited healthcare capacity, you could see situations that are even worse. Usually, we see diseases, and I don't want to make the comparison between COVID-19 and the flu because it's not just another flu, but because it's a new disease, we have to look at what we know about other viruses. And what we see with things like flus and other infectious diseases in the past are that the impact in rural areas comes later, but it often gets hit harder.
One of the lines you say is that one shouldn't talk about class differences without also discussing race. How does that work into this whole equation?
Yeah, that's a great question. Sometimes people like to talk about inequality in a single dimension, and that's where whether that's a racial dimension or whether that's a socioeconomic dimension. And the issue is that these factors both have an impact. So when you live in poverty, that affects your health. And so when you stratify by race and look at the health of white Americans versus Black Americans have an outsized exposure to poverty and they also tend to have worse health. But the issue is that you can't assume that all of those adverse health outcomes are just due to factors like poverty, because even when we control for income and education level and all of these other things, we still see that Black Americans tend to have worse health. And a lot of the research points to the fact that it's the stress of dealing with racism and racial inequality that really has a cascading effect throughout people's lives. And some of this can even be heritable across generations. So it's a huge issue.
One of the groups often not talked about in this crisis is the indigenous population. Michigan has tens of thousands of people who are definitely, fellow Michiganders, but also not necessarily traditionally part of the system, and they face a very unique set of challenges. Can you talk a little bit about how this could impact them, Tim?
Yeah, absolutely. And that's a great question. We talk a lot about historical trauma when we look at health disparities affecting the Black community. And this is a really significant thing that affects people's health. And those historical traumas are also really key to understanding the risks and challenges faced by the indigenous population in Michigan and the US in general. And so our indigenous population has some of the worst health outcomes in the state: shorter life expectancy, really high rates of tobacco use, high prevalence of chronic conditions. And in terms of COVID 19, when you look at factors like intergenerational housing, that puts elders at risk. And our Indigenous people tend to be in rural parts of the state and have really limited access to healthcare. And so they face a lot of the same challenges that the rest of rural Michigan faces, along with having some aspects of historical trauma and health disparities that we've seen with the Black community in Detroit. So I think people really need to pay attention to this and prepare to try to mitigate the damage before it could occur.
So, Tim, one of the things that strikes me about all of this is that there is so much health support here in Metro Detroit, and even that has been creaking under the weight of coronavirus and COVID-19. You've got hospitals that, have too many bodies to deal with. You've got situations like here in Detroit with DMC Sinai Grace being just basically a mess. But I did some background research before talking to you. There are whole counties in Michigan that don't have a single ICU bed. There are far fewer hospitals, and you've still got a lot of people living in various areas. Now, I imagine a place like Grand Rapids might have a little bit more support, but it feels to me like there is not a huge amount of emergency and trauma services outstate, and COVID-19 seems like it takes a lot of those resources to fight. Are we prepared for this, and what are we looking at if this, and possibly when this spreads to rural Michigan?
So you're absolutely right that the healthcare capacity in rural Michigan would not be prepared for the kind of massive outbreak that could happen without policy interventions and other things to slow the rate of spread of the infection. We typically, for specialty services, see that folks from northern Michigan have to travel a long way to get hospital services, or they rely on telemedicine. And in many ways, that can be effective. But in terms of someone who needs an ICU bed or possibly a ventilator, the capacity isn't there if we had some sort of big outbreak. That's one strength of Metro Detroit that has helped us mitigate the damage that we could have experienced. It takes a really heavy population density to provide the kind of financial support needed to maintain that hospital capacity. And we just don't have it outstate.
Well, and finally, you kind of wrap up with this idea of that health versus the economy is a false dichotomy. Can you talk about that? Because I think there's this really big push in some circles, in some places in the country, and then you've got some folks in Michigan who are just itching to reopen the doors on everything. And can you talk about this kind of false dichotomy that you see?
Yeah, I think we live kind of in the age of false dichotomies in many ways. And pandemics are a dangerous kind of issue to politicize. They affect all of us, and viruses obviously have no political affiliation or cultural or social biases. And so I hear a lot of arguments that on the one hand, we need to protect health at all costs. And on the other hand, we need to open up the economy. The costs that we're facing aren't worth the health savings. But the two are so interrelated that you can't separate them. There's some value to recognizing that people stuck at home, losing their livelihoods, are going to experience some negative health outcomes from that. At the same time, just opening up the economy and going back to business as usual puts us at risk of facing further costs from the virus. And certainly those costs we see in healthcare, we were talking about hospital capacity, even amid the surge in need for ICU beds in Metro Detroit, we see health systems like Beaumont having to lay off employees because they're experiencing losses due to the cost of treating COVID-19. That could affect rural Michigan as well. And so there are costs on either side of this. Economics is a thing where we like to think about just jobs and money, but really economics is a system of fulfilling the wants and needs of the society and doing so ideally in an equitable way. One of those wants and needs is being healthy. You can't pursue your own happiness if you're not healthy. You can't experience liberty if you're not healthy. You can't be a productive worker or an entrepreneur if you're not healthy. And so I think there's a shared importance in investing in things like public health going forward. One of the reports that the Citizens Research Council released in 2018 looked at the fact that the state of Michigan over time really disinvested in public health. And when I say public health, I don't mean Medicaid or government paid health insurance or healthcare. This is really the kinds of population health initiatives that governments are responsible for, like safe food, a clean environment, and surveillance and testing and contact tracing and all the things that we do to control the spread of infectious disease, whether that's HIV/AIDS, hepatitis A, or any other number of diseases. And we've disinvested in those things over a long period of time. And so we need to get the economy going. We need to make sure that people can provide for themselves and have some sense of purpose and livelihood. But that requires some expenses in terms of scaling up our ability to do ongoing disease surveillance, contact tracing, and the other things that are necessary to keep people safe while we do it.
Well, Tim Mischling from the Citizens Research Council of Michigan, thank you so much for your time today. If people want to know more about what you're doing or follow you, what can they do?
Anyone can visit our website at crcmich.org, and we're on most social media platforms as well, so please follow us. And we provide all of our research reports, blogs, our own podcasts and webinars free of charge to the public. It's a service that we provide.
A quick reminder before we go that Daily Detroit is powered by the people through their direct support. It allows us to do in-depth coverage, and since we're not wholly dependent on ads, we don't need to do clickbait. We can focus on smart news for our very intelligent listeners. You can join our other members at patreon.com/Daily Detroit. Another way to support us with no money, you can share the show with your friends. Send me a screenshot if you did to dailydetroit@gmail.com or tag us on Facebook, Instagram, or Twitter. We'll be sure to say thanks. We're also working on a newsletter to go with this. If you have ideas for that same email address, dailydetroit@gmail.com. We're taking suggestions. With that, I'm Jer Stays. Take care of each other, and we'll get through this together. Talk to you tomorrow.